All right, in today's video, I'm going to talk about the absolute best alternative ways to treat pain. Not manage it, but treat it. So when I talk about treatment versus management, I've talked about this in other videos. I kind of bristle. At some point, I was called a pain management doctor in my career just because I did pain procedures. And categorically, insurance companies put pain management. And when I think about pain management and what most people's view, even the patient's view of pain management is, there's nothing really to do here. I just got to manage this. There's not a definitive treatment. And so I'm kind of left in this bucket to take pain pills and manage it. And a lot of patients I see that are attracted to the type of practice I have as a non-surgical orthopedic doc, somebody who specializes in regenerative medicine, kind of a more holistic approach to health to say, how do we optimize the body's ability to heal and get people back to what they like doing? Well, a lot of them don't like to manage their pain. They really want to understand root cause. And I've talked about how do we get to root cause, especially of knee pain. What are the diagnostics? What are the tools we can get to really evaluate somebody well with 2024 technology? Not just x-rays, but things like MRI, things like dynamic musculoskeletal ultrasound that we can get real-time imaging with motion of what's going on inside these joints. So if we got a clear diagnosis and somebody's working through this healing cycle and they're on that journey and they're looking for better alternative strategies to treat pain, that's what I'm talking about in today's video. So I'm going to give you 3 C's, 3 banks, and 3 required elements. So let's get into the 3 C's. Over my shoulder, here are some of those C's that I have inside of these products. Yes, shameless plug for some of the products in my practice. You do not have to buy them from me. But let's talk about curcumin. Curcumin is one of the most studied natural anti-inflammatories around. Back to Ayurvedic medicine, like hundreds if not thousands of years ago, we're talking about the ability of plant medicine to help people, right? This is where most of our synthetic medications are now derived from. At least at a period of time, we were mimicking things that we would find in nature and figure out how to synthetically reproduce them. So if we look at curcumin or turmeric root, it's a potent anti-inflammatory. Studies show that maybe milligram per milligram, it could be equivalent to ibuprofen, Aleve, naproxen, some of these things that are commonly taken over the counter. But it's one of the big C's in my 3 C's that for most people it's very well tolerated. Some people can have some stomach distress because of this stuff, but most people tolerate it very well. So curcumin, potent anti-inflammatory modulator, doesn't block all these good pathways in the body that we want for healing, but could be a great substitute for something that you have. And of course, anything in this video, you should run it by your personal health provider, practitioners, to make sure there isn't any reason why you can't take these kind of things. So curcumin. Next one would be collagen. So collagen is an essential molecule, nutritional element inside our joint tissue, ligament and tendon tissue. So if we really look at it at the microscopic level, we have these threads of collagen that make up the tendon structure, the ligament structure, the cartilage structure. And what people have seen over years of studying this is that collagen may be an essential ingredient because we know it gets depleted out of our body in our late 20s, maybe peaks at age 30, and every year after that, we waste away about 1 to 2% of our collagen. And collagen makes up a lot of our protein mass. Collagen makes up a lot of the mass in these structures, so our ligaments and our tendons and our cartilage. So if our goal is to preserve those things, collagen is an essential nutrient for that. Now, there's a lot of debate, do we have empirical evidence that collagen works and can we study it? Well, we can do that in mice models. So there has been mice models that have studied certain branded forms of collagen, and mice were fed collagen and then they were harvested over here versus mice that didn't, harvested over here. And they looked at the collagen, or they looked at the cartilage structure. And the mice that took collagen had healthier looking cartilage. Then they took that to human studies and they said, hey, if we gave this to a couple of thousand people and we looked at what are they telling us about joint pain, stiffness, swelling, and these other things, well, a good percentage of people taking collagen felt better. Now again, every study comes with a caveat. Was it really because of the collagen? Was it because they thought they were taking something that could be beneficial for their joints and therefore there was a placebo effect? Because there's a placebo effect to a lot of the things we use. However, there is some good science to back up both in animal models and some sizable studies. I mean, 2,000 patients isn't a small study, that a lot of those patients reported benefit. And from a risk standpoint, it's very low risk unless you have sensitivity to the things that collagen is derived from. And most collagen Again, if you're a vegan out there, you're not going to find a vegan collagen. There is no such thing. They're trying to make these in a lab maybe, but they're not there yet. So most collagen is going to be derived from marine sources or chicken sources or cow sources. Some parts of those animals that we probably don't want to get into the nitty-gritty about how that's actually produced. But these substances are hydrolyzed, which means they're broken down into small particles where when you ingest them, we could potentially, and I say potentially because there's no way to definitively prove that other than how you feel, that these could then be reconstituted in the tissues where you need them. So collagen can help with healing, it can help with inflammation. Some of the collagen products actually have natural anti-inflammatories inside of these products, like one we have in our practice. So you kind of got to get this dual action. You have a building block, but you have something for inflammation. So curcumin, collagen. The third C, if we get into CBD, I don't think you can be alive today and not hear of a CBD product. But we have an endocannabinoid system in our body, and it's a body receptor that's very receptive to those compounds. And some studies will show that the binding effect is actually more potent in a way than what opioid binding is, so opioid painkillers. But if we can kind of charge up that natural endocannabinoid system with some of these cannabinoid compounds like CBD, what we know about CBD is it's a great natural anti-inflammatory. And we're talking about pure CBD. This isn't THC products, just pure CBD. So these can be done in a topical, like we have a product, a company we use, it's hemp derived. This is a roll-on, like the old, rollerball deodorant sticks. But you can use this and spot treat areas of pain, whether it's elbow, knee, shoulder, wherever it is. And you can get local absorption here topically into the tissue and help with pain and inflammation. So a great tool to use because we can bypass the whole GI system where a lot of people can get stomach upset, especially with medications. But even with some of these great natural alternative choices, they're still not agreeable for every single patient when taking those things. So 3 C's, curcumin, collagen, CBD products, great stack that we use routinely with our patients to help with inflammation, controlling that element while they're working through to a more definitive treatment. So now I want to give you the 3 B's. I give you the 3 C's, I'll give you the 3 B's. So the 3 banks in our body that now if we're moving into a more definitive treatment in my office, that's where we may be using some form of orthobiologic. So orthobiologics are cells that we can take from you, the patient. And we have 3 banks of cells. We can take cells out of your arm through a blood draw to get platelets. We can take cells out of your fat tissue to get a fraction that's called the healing niche. And inside of that, there's growth factors, maybe some stem cells. And then in your bone marrow, we have another bank that we can tap into. And if you look inside, very conveniently, a bone right here. Inside there, that's the marrow. So that's where all of our blood cells are made. So red cells, white cells, platelets, stem cells, all live inside the long bones of our body or the pelvic bone of the body. And this is an area that we can tap into through an office-based procedure. Again, with local anesthetic, you wouldn't want it done without that, but we can tap those cells out of those 3 sources. So these are 3 banks, blood, fat, bone marrow, 3 banks that we can withdraw from to get cells, and the cells we're after are stem cells and platelets, because what is inside those cells is the blueprints and growth factors that our body needs to heal. Right? This is what is innately going on in your body as you're sitting and thinking about, why isn't my knee healing? Well, it's trying to heal you. The cells are working. There's just maybe not enough supply for the demand that's needed. So if we can draw out those cells from those banks, we can deposit them in those areas to stimulate healing, we can really accelerate that healing curve for a lot of people. Okay, so 3 C's are going to help you control symptoms, inflammation, in a way that doesn't gum up your body's natural healing mechanisms. 3 banks of cells that are available that we can use to augment healing to get you there faster. And then the 3 critical elements that I talk to all of my patients about is 1, we got to give your body time to heal. And some people are just too impatient. I can be one of those people at times, but our body, once injured, is going to require a certain amount of time, depending on the severity of injury, to heal. Could be 4 weeks, could be 6 weeks, could be 8 weeks, could be longer. But when we set people down these pathways we do with these type of orthobiologic treatments, we're talking about a time frame of 2 to 3 months, which again, if you love doing something and you got to be out of it for a long time, 2 to 3 months can feel like a long time, but in the grand scheme of things, it isn't. And for most of our patients, we're talking about an interval over here that may be 2, possibly 4 weeks, where we're restricting and modifying some of that activity, but they're still able to participate in some of that. Okay, and then as they move through those stages, they're going to heal, the tissue adapts, it gets stronger, and then we can apply more demand to it. So, but it requires time. It also requires space. When I talk about space, it's the space around somebody and the space within them. So we've really focused on the rest of their health at that point. When you're in this healing stage, like what's the quality of your sleep? What's the amount of stress when you're in your waking hours? So this yin and yang of, look, if you're not repairing at night, if you're not sleeping deeply, you're not giving your body the opportunity to heal and repair and regenerate. That is when we heal, repair, and regenerate. And then during the day, if you're just burning it on both ends, stress out from the time you wake up to the time you go to bed, well, man, you're just burning and chewing through resources that your body is going to put into survival mode more than it's going to shuttle that stuff over here to repair mode. So again, in that space, we want to think about also how you're feeding the body. What's the nutrition, hydration, all the other things that are going to help it heal. I'll go deep dive on that in another video. But again, this is that space concept. Look at the space around you. How are you setting your body up to have success to heal? What's the internal physiology of your body? How do we map some of that? And hey, take that time. When I'm injured, when I got to go through treatment, I say, hey, what can I do in these 3 to 4 weeks that I'm not typically doing when I'm training hard, pushing hard? I can focus on my sleep more, my nutrition more, my mobility, flexibility more. I can work with some of my other providers on me more so that when I get back to the activity, I am a better athlete to go back to those things. And the final thing leading into that is rehab. So the third critical element is some form of rehabilitation. Because a lot of patients I see, they just want to get the pain to go away. And we can effectively do that with those 3 C's or those 3 banks that you learned. But then I say, hey, we got to rehab you up. Movement mechanics, right? How is your body moving? And think about how it was moving all those weeks that you were living with the injury. Your body is a great at adapting to the situation, okay? So if you have a problem in your knee or your shoulder, you've often seen your body like making these moves if you have a shoulder injury where you're now like hiking your shoulder to elevate your shoulder. So subconsciously, your body's going to find the pathway to kind of survive and still do the thing you need it to do, but it's doing it in a very inefficient manner usually. It's tapping into muscle and movement patterns that aren't efficient, that aren't how the body is designed to work. So we'll start to be using moving muscles to stabilize or stabilizing muscles to move, and we got to kind of unwind that. And that is that time, space, and rehab philosophy. So if we're giving it the time to heal, you're giving it the space to prep the environment in and around your body, and we got you with the right person, physical therapist, movement correction expert, personal trainer, sports-specific trainer, somebody that can use that time to really leverage that time to work on your body mechanics, rewire those pathways that you need. Then as your body heals out the other side, 1, you should hopefully not get re-injured. 2, you'll learn a lot about what it takes to keep you on that side of out of the injury danger zone. And 3, ideally bulletproof you for the future to keep you back out doing what you like to do and spending less time here in my office getting treatment. So if you like that video, like that. If you like content like this, subscribe. If you have a comment, a question, something on this content that you saw today, drop it in the comments. I got a great team that jumps in there, answers questions, gives you direction. Of course, you know, I can't see you as a patient unless you're seeing me as a patient. I can't give you medical advice all the time, but we can give you direction. That's our goal by doing this content, is give you some information to talk about with your own practitioners, or seek out the type of practitioners that do this type of stuff. Or if you're local, regional, or don't mind traveling, you can see us here in our office. So in the notes below, there's a link to a form that actually, if you wanted to be seen here in our office, you want to talk to somebody on my team that does this day in, day out with our patients here, they're happy to jump on a call. We call it a discovery call. They can work on you through a mechanism of just interviewing you, seeing what the case is, what do we need to solve, what type of treatments can we give you advice on, because that's what we're here to do. That's why we do this type of content, to help you in any way we can.